So, your doctor or midwife has mentioned that you might need your labor induced, and they have talked about something called a balloon catheter. And honestly, that phrase alone is enough to make anyone nervous. But I promise you, by the end of this video, you're going to understand exactly what it is, why it is used, what it feels like, and whether it's the right choice for you. By the way, I am Asha. I'm an obstetrics and gynecology doctor, and I make these videos so that you can walk into your maternity appointments feeling informed and not overwhelmed. Let's go straight into it. So, in a normal pregnancy, your body decides when labor starts. Your cervix, that's the opening at the bottom of your womb, gradually softens, shortens, and opens up on its own. That process can take days or even weeks. But sometimes, for medical reasons, we have to encourage that process to start or speed it up. And that is called induction of labor. Now, there are different ways to do this. Some involve medications, and some involve breaking your waters and getting you started on the drip. And one of the gentlest ways, especially when your cervix is not quite ready yet, is using something called as a Foley's balloon catheter. So think of it as a way to gently nudge your cervix to start opening up before anything else happens. Okay, so a Foley's catheter is a thin, flexible tube, a bit like a soft drinking straw, honestly. At one end of it is a small deflatable balloon. Here is what happens. The doctor or midwife gently places this catheter into the vagina and through the opening of your cervix. So the balloon sits just above it inside the lower part of your womb. And then they would inflate this balloon with a small amount of sterile water, usually about 30 to 60 mils. The balloon is now sitting in the space between your cervix and your baby. And here's the clever part. It doesn't do anything actively to start contractions. It just sits there, and the gentle, constant pressure that it creates on the cervix signals to your body that it's time to start softening and opening. So usually this catheter stays in place for around 12 to 24 hours in most places, or it may fall out on its own when your cervix is opened enough. This is actually a good sign when it does. It means that your cervix is already opened. It's completely safe for your baby because the balloon sits below where the baby is. It never touches them. So when do doctors actually recommend a balloon catheter induction? There are several situations where this might be suggested. One is if you have gone past your due date. If you're 41 weeks pregnant and your labor hasn't started naturally, your care team may recommend induction to reduce certain risks. So in our trust, we wouldn't recommend induction of labor with a Foley's catheter if your water has broken and if your labor hasn't started. Second is if you have a health condition that makes it safer for you to deliver sooner. This include things like high blood pressure in pregnancy, if you have diabetes, or problems with how your placenta is working, or if you have a big baby. Big baby means baby measuring more than 90th centile. Third is if your baby isn't growing as expected. If scans show your baby may not be getting everything they need in the womb, your team may want to deliver them earlier. Fourth is if you have had a previous caesarean section. This is actually one of the key reasons a balloon catheter may be chosen over other methods, because it is considered low risk in women to have a previous C-section compared to certain other medications. Now, while this method is safe for many people, it is not suitable for everyone. Your care team will always check this before recommending it. A balloon catheter induction would not usually be recommended if your placenta is low lying. If a placenta is covering or sitting at the opening of the womb, placing a catheter into the cervix would cause bleeding. If you have active bleeding, so if you're already experiencing significant vaginal bleeding, this isn't the right time for this procedure. Third is if you have a known infection of your cervix or your vagina. Introducing a catheter could push that infection upward, which we would want to avoid. Sometimes your baby is in an unusual position. For example, if your baby is lying sideways or feet first, induction by balloon may not be appropriate without first addressing the position. Another reason why we wouldn't recommend Foley's catheter is when if your baby's head is not well into the pelvis and is free floating. So if your cervix is already well dilated, that is, it's opened up significantly, there may be no need for this step at all. And other methods would be more appropriate, like breaking your waters. So your team will also consider your full obstetric history, any previous surgery to your cervix, and your baby's well-being before recommending any type of induction. I know this is the part that you have been waiting for. So when the catheter is being inserted, most people describe it as a feeling like an internal examination. A little uncomfortable, maybe some pressure or cramping. Some people say it's no worse than a smear test. Others find it more uncomfortable. Everyone is different. But you could choose to have a gas and air while you're having the procedure done. So once it is in place, you may feel a dull ache or pressure in your pelvis, something like a period cramp. Some people barely notice it at all. So you'll be able to walk around, eat, and rest with the catheter in place. And there's a small tube that sits outside your body, which will be taped to your thigh to keep it comfortable. And when it either falls out on its own or if it's removed, your cervix will be reassessed again, and the team will talk to you about the next steps in your induction journey. So to recap, a Foley's balloon catheter is a gentle mechanical way to help your cervix soften and open in preparation for labor. It is used when your body needs a little encouragement to get started, and it's a great option for many people, including those with a previous C-section scar. Like any procedure in obstetrics, it is not right for everyone, but your team will always explain the reasoning and give you the chance to ask questions. And speaking of questions, if you have any questions, drop them below. I genuinely read them and they often inspire future videos. So if you found this video to be helpful, give it a like, share it with someone who is about to be induced, and subscribe, because every week I'm here breaking down pregnancy and women's health in plain language. So you deserve to understand what is happening in your own body. I'll see you in the next one.